Not just the Mercy Watchers, but everybody. So today, I have the great pleasure of welcoming Dr. Kristina Leyden. Dr. Leyden, welcome.
I'm happy to be here.
So you're in the hot seat, but no, not really. We're just having a little fun and getting to know you because I want everyone to understand the great gift that you are to this university and this world by the work that you do and the life that you lead. So is it okay if we just launch in by your telling everybody about you? Where are you from? What do you do? All that.
Wow. You should just wait for the movie to come out.
Oh, nice.
I grew up in Alaska.
Yes.
Which is a fun fact. And then kept moving south. Undergrad in Washington State. And then I looked for a great master's program and found myself in Galveston at UTMB, where I met my husband. And he's Houstonian bred, so that is why we are here.
Yes.
But I did my nursing up in community college for an associate's degree, then got my bachelor's, then my master's, and then my PhD here at UT Houston in the Med Center. Yeah, I joke that I stalked the previous dean to get a job here.
And that was Dean?
That was Dean Church.
Dean Poldy
Church, the founding.
The legendary.
The legendary Poldy Church who restarted the program here. I taught at other universities through the master's program, undergrad. I knew I wanted to teach because I'm also a family nurse practitioner, so I do clinical practice and take care of patients. But I knew I wanted to teach in a Catholic university because my spirituality is something that, like, how do you talk about taking care of a patient of another without understanding the human person and like this creation? And so I love to be able to talk to students about their spirituality, to then talk to the patients about spirituality, because we're a holistic nursing program, which means we cover the whole gamut of the person. You know, some medical nursing is really, the motto, treat them and street them kind of thing.
We don't take care of diseases, we take care of people.
We take care of the whole person. And so that means like talking to your patient about their motivation, their life, what makes them get out of bed in the morning, what makes them control their diabetes or their blood pressure, what are their goals in life and their hobbies, by giving hope and putting them in the best position to heal.
So that sounds a little bit, and I've heard you say this before, the art, right?
Yes.
Of nursing.
Yes.
The other phrase that I often hear you and your colleagues in our Peavy School of Nursing talk about is the ministry of healing and how we help prepare students for that part of the practice.
Yeah. So in a textbook, you're reading about the thing that you may do. You're practicing a skill of putting an IV catheter in, or a Foley, or wound care. But the art is really putting all those components together and putting the patient in the best position to heal with all the factors, with their spirituality, with their social life, what's happening in their family, what put them in that position to be sick in the first place. And so, wrapping it up and putting a bow on it to help them understand all those components. Because if you're just taking care of the wound, well, what caused the wound in the first place? And you're just putting a Band-Aid on it. So you want to find the cause, not just put Band-Aids on things. And so we do a lot of work in our simulation lab to help our students with this, and they get to practice in a safe environment therapeutic communication. For those of you that don't know what our simulation nursing lab is, please come and see. I'll give you a personal tour.
Right.
But we use mannequins or robots.
Right.
High fidelity. They breathe. They speak. We can also have them expire.
And have babies, right?
They have babies.
They can have babies.
And our pediatric one and our new mannequin, they actually cry. Fluid comes out. We also use live persons as well,
Yeah.
students or volunteers, either community or some of our staff. And
Right. And so you get these mannequins or real actors,
Yep.
and they're the patients.
Exactly. And so, like, for example, last spring, we did a simulation on like a disaster simulation. And then we had what we call moulage, where we put makeup and dress them in a certain way to make it look like they have a specific wound. So we had specific gunshot wounds and cuts and bruises and smoke and inhalation areas. And then our student nurses triaged those persons and put them in immediately into critical care, or they put them into, they categorize them. And so this gave our students, because we don't want disasters to happen, right? We do not. But we do need to help our students prepare for if those things do happen. And the same thing on a smaller scale, some of the things that we might have to take care of are patients that have shaken baby syndrome or a woman who's hemorrhaging after birth. We don't want those things to happen, but we do. So simulation is a wonderful way to introduce those topics and have our students work in those areas in a safe area without those things happening.
You're getting them ready for that which could happen at any minute. We hope it never does.
Yes.
But they're ready.
What's
They're
the
prepared.
saying? Prepare for the worst, expect the best.
Okay.
Okay.
I want to do that.
Yeah.
So that sounds like it might be a little innovative, right? I mean,
I think so.
You hope that everybody's doing that, but with our simulation lab being as good as it is, and with these scenarios that you develop that really are out there in some ways, talk to me about how the Peavy School of Nursing, and in particular you, I guess you are a leader in the innovation grant that we have for nursing. So can you talk a little bit about how innovation plays a part in this holistic approach to patient care?
Absolutely. Nurses are known for what we call workarounds. Innovation is a much nicer word for that. But as a nurse, you are in a position to take care of a patient. And if the patient's bleeding, and you're out of something, you are going to find something to fix that patient. So we are, by nature, we're already a little creative and innovative of trying to develop new processes, how things can work better. And we specifically promote a reflective practice. And so that is where we are constantly looking at what has occurred, reflecting on it to get, it's a little bit like St. Paul, test everything, retain what is good, right? where you're looking at a scenario, and as faculty, as a nurse, you do this, and as faculty, we do this every time we do a simulation or a class. We're constantly reflecting on how we can make it better, how we can meet the needs of this one student, even if it was only one student that didn't get it. And so when we're looking at innovation, this grant, Nursing Innovation Grant Program, and it's specifically regarding educating our faculty on simulation to improve how we give our students simulation to help them learn what they need to learn. And it's been really wonderful. So I'm the only certified healthcare simulation educator in our team. And we've been able to educate our faculty on the best practices so that we maintain standards so that all our students are getting the best practice.
Right.
And one of our faculty is going to sit for her certification soon. Oh. And I'm going to renew as an advanced certifier.
Well, there you go. Just advancing. Always. Well, and you know, what strikes me is our students and the patients that they will care for are so lucky. Right? So lucky to have you and your colleagues who are really pushing the boundaries of innovation, which is a characteristic, right, of great nursing, but really taking it to a whole new science and art form here at the University of St. Thomas.
Yes, absolutely.
So we know that you're not just, although it's pretty impressive, a nursing faculty member and advanced simulation guru, right? But you also have some other interesting things that sort of round out your life. I heard, now I don't know if this is true, that maybe you have your own urban homestead going on. What's going on with that? Tell us about that. Very exciting.
Well, I'm fascinated with complementary therapies and homeopathic therapies. I'm fascinated with nature. I'm fascinated, like, this is a fun fact.
Mm-hmm.
So diseases that occur in certain areas of the world,
Mm-hmm.
the plants that naturally grow there are often the ones that correct that condition.
Right.
It's like, for example, where in the tropics where you have dehydration, you've got coconuts and pineapple and things that are so wet and
Right.
right, to help
yeah.
with hydration. In the fall, what grows? Potatoes and high carbohydrate pumpkins and squash, and those are meant that, number one, they last really long.
Yes.
And they're meant to like fatten you up during the time where things aren't growing. I mean, so I think God is so cool every time I talk about this.
Well, it seems like he's thought of everything.
He has
right?
thought of everything. But I'm also I'm co-teaching a freshman symposium class with our history professor on it's called Explore Heroic Women Who Revolutionized Medicine and Their Complementary Therapies. So she's covering the history part, and then I'm making the potions with the students.
Yeah.
And so my yard, so we've had a drought, right, in Texas this summer. I did not water my garden once. Because of the way that I built it up. So it's a 3 feet keyhole garden. It's 3 feet high. And how the garden gets the nutrition is in the center of that keyhole. Imagine an antique keyhole is all your compost. And so as it's composting, it's moistening and giving. So I got so many watermelons. My basil's incredible. I've got potato.
Wow.
You've
just got it all. So if we get a little short on produce, we just head out to...
I will not tell you my address on air.
Well, okay.
But also like peppermint and lavender and rosemary and sage. Those are all things that you can make. You can make medicinal deodorants, essential oils. And we've had goats and we've had bunnies. Bunny manure is like amazing for your garden. We've had some sheep. And so we just have a lot of fun. Oh, we have chickens. I forgot. Nicole Walters calls me the chicken lady. And I was like, I don't know if I want to be known as the chicken lady. And Father Lockie said, well, it's better than being known as the old goat lady. So I'm like, okay, we'll stick with chicken. So, yeah.
Well, you just got a menagerie out there. That sounds fascinating.
And it's in city limits.
That's awesome.
Yeah.
So all of that sort of, it sounds like a holistic approach to life, right?
Yes,
you're bringing that experience, sharing that perspective with our students, and making their lives richer. Because I'm going to guess a lot of them don't have a keyhole garden at home. No.
And a lot of them don't even know the benefits of some of these things that are in your pantry.
Yeah.
I'm just immune-wise or antibacterial or antifungus, and I take students on mission trips as well. Right. And some mission...
Where do you go on mission?
Oh, well, I'm glad you asked. Yeah. We go to Honduras. My husband is half Honduran. And so we go to Santa Lucia and Niguara, Tegucigalpa. And we've collaborated with a wonderful Catholic mission trip from Cleveland, Ohio. When I go in our groups, we're looking at what are the community resources so that when we leave, they can maintain their health.
So it's teach them to fish instead of giving them a fish.
Yes, exactly. So we had this one woman who she washed clothing for her job, and she had diabetes, and so she had yeast on her hands, poor woman. And so we gave her a cream for a couple days, and then we switched her to cinnamon powder.
Well.
Cinnamon powder is actually anti-yeast. So after you, with the cream, that kind of helped with the maceration and kind of get her over the hump. And then the cinnamon is after you're doing your daily work, you dry your hands, wash them, and then you put the cinnamon powder to kind of get that moisture and anti-yeast. Great for the shoes, for athletes' feet.
Well, and I've heard that cinnamon is very good as an anti-diabetic kind of.
Yep, it helps regulate some insulin levels, yes.
Oh, nice.
We made cinnamon salve, which is also a mosquito repellent. If salve is with a beeswax or coconut oil, and you can put it on your legs as a lotion, and then it's a mosquito repellent as well. We made that as one of our freshman symposium
Well, that just
pieces.
sounds terrific. I may want to go with you on one of these
Okay, come on.
homeopathic mission
Journeys,
trips.
yes.
This is awesome.
Yeah.
Well, I want to say thank you. Thank you for joining me today and sharing with our audience all the really cool things, from the Innovation Sim Lab to the mission trips in Honduras and everything in between. It sounds like a fascinating life, a great way of engaging students and helping make the world a better place. So thank you so much.
I'm excited to be here. Thank you for having me.
And thank you for joining us. I appreciate it. God bless you.